We're recording. Okay, sit tight. So this is the first of 6 quick refresher lectures, meetings, discussions, forums around the subject of foal care in anticipation of another successful season with our breeders. This one specifically on neonatal maladjustment syndrome. Now, what I'd like to cover is the physiology of the normal foal, how the physiology has changed in the foal suffering from neonatal maladjustment syndrome, the progression of that disease without treatment, the ways of treating it, and then that should fill the 10 minutes. So the normal foal is very mature neurologically at birth compared to other species, in particular humans and dogs, for example. In order to maintain safety for the mare within the womb, the foal is inhibited neurologically, because although the capacity in the brain to respond to stimuli such as sound and movement is there, we don't want the foal moving in the womb. So there's several factors in the womb environment that inhibit awareness, inhibit consciousness in the foal, and they vary from the relative lack of changes in temperature and the fact that it's isolated from smell, and the sensation of touch is constant with the womb environment. But also there's neurological active sex hormones, mainly in the progesterone group, such as pregnane, and there's aldosterone released from adenosine released from the placenta in huge quantities that have a direct effect on the brain to reduce consciousness and to keep the foal in the somnolent state. And obviously, when the foal is born, those neuromodulators, the inhibitory ones, are removed somehow, and we'll come to that in a minute. And there's excitatory hormones which increase awareness, that are increased in concentration in the brain. And also the external stimuli, especially sound and smell and touch and cold, improve the general awareness of the brain and bring the foal to consciousness. And this happens quite rapidly over the course of 20 minutes to 2 hours. Now, there are various studies out there that show, and we'll scroll up to these now, that show that people have tested this hypothesis, and they've measured the sex hormones in foals, both in the normal situation and the abnormal situation, and they've also infused the inhibitory sex hormones into the brains of otherwise normal foals to show that the presence of high levels of the sex hormones to reduce awareness cause the foal to lose the ability to react to the environment. Now, what's the significance of a foal when this process goes wrong? Well, firstly, it is one of the most common syndromes we see in the field. The reported incidence is between 1% and 2% of foals, but given the incidence of 1% to 2%, the potential significance of those foals that suffer from neonatal maladjustment syndrome is huge, because if the foal is inhibited neurologically and isn't aware and has a reduced level of consciousness, then it cannot adapt to the environment, and the consequences of that are death. So these foals die without being treated, and the reason for that is the foal initially can't follow the mare, which is danger in a wild environment, obviously, because the foal loses the ability to bond with the mare. It loses initially these foals are noted because the mare might be walking one way and the foal will be walking the other way, or subtly the foal will follow a human rather than follow its mare. When the mare talks to the foal doesn't usually talk back with that particular whickering noise. In fact, it is reported, I've never actually heard this, but some foals will bark, or literally bark, but it's got an abnormal vocalization, and instead of a whinny, it's more of a bark. And as a consequence, then the foal cannot feed, and then there's other aspects of neuroregulation of the body that are abnormal. So the foal can't thermoregulate, the gut motility is reduced. As a consequence, the foal rapidly gets hypothermic, hypoglycemic, and the consequences of that lead rapidly to metabolic disturbances, acid-base disturbances, sepsis, seizures, and death. So it's not good. However, given sufficient support or a procedure to reverse the sex hormone status in the brain by squeezing the thorax to trigger a neural reflex in these abnormal foals as soon as they're detected, to reduce the neuroinhibitory sex hormones and increase estradiol, which is one of the stimulating hormones in the brain environment. Then for 80% of these foals survive. The ones that are squeezed tend to revert to normality, or towards normality, towards enough function to survive independent of humans within 1 hour to 24 hours. And this squeezing of the thorax is known as the Madigan squeeze. And the theory behind it, it's hard to prove, I suppose, but they're working on it, is that foals that are born normally experience a dramatic squeeze of the thorax, the rib cage, when they're being born, and they're stuck in the birth canal for maybe 10 minutes, 20 minutes, which is good. The head is out, so the oxygen's getting into the lungs, but the thorax is squeezed during labor, which triggers a neural reflex, which creates an enzyme activation in the brain to reduce progesterone related hormones such as pregnane, and converts them to estradiol. The estradiol is a neuroactive hormone, and within 20 minutes to 1 hour of birth, that foal then is environmentally aware, conscious. It can feed, it can follow the mare, it can bond with the mare, and all's good. The trick is recognizing the foals early enough before they go into a metabolic crisis, hypothermia, or develop sepsis, or indeed within the window where they're still going to maintain immunity from passive transfer. So ideally, we'd spot them in the first 6 hours. However, it turns out that the majority of patients, of foals that have neonatal maladjustment syndrome, are born normal. And if you think about it, the normal foal from normal pathophysiology or normal physiology, as soon as they're born, the enzyme process is happening. It's not as though it's an instant switch in the brain to estradiol compared to progesterone. It takes a few hours. So it's hard to detect or hard to predict which foals are going to get neonatal maladjustment syndrome at the point of birth. The optimum time to detect them is within the first 24 hours. And I think that certainly it's worth clients knowing to keep an eye constantly, a vigilant eye on the foal, to look for signs within the first day. And the first signs could be that the foal doesn't follow the mare, it follows the human. It could be that the suckle reflex, although it's there initially, wanes during the course of the first day. And at that point, they should be educated to trigger a call to the vet for us to go and assess. And if we agree that there is a chance that the foal could become a dummy foal, then to jump straight in with the thoracic squeeze. We call it the Madigan squeeze, or it's called the Madigan squeeze after John Madigan at UC Davis, who pioneered the work over 10 years ago now. And I don't think anyone's ever reported any side effects of doing the Madigan squeeze. So if you happen to do it to a normal foal, it's not a disaster. It doesn't cost anything, and there's no side effects. So don't be scared to do it on a hunch. There is another way to manage these foals without the Madigan squeeze. It also happens that 80% of foals, so there's a similar sort of percentage of outcomes of foals that are successful can be treated without the Madigan squeeze, but it's not recommended because the other way of successfully treating these foals is to hospitalize them. And the range of hospitalization duration is 2 to 10 days, during which time they need to be maintained in an environment a little bit like the foal was in the womb. So the neurologically unaware foal with reduced consciousness that's depending on the womb environment needs that environment during the period of hospitalization, while the brain slowly sorts itself out and the hormone mechanisms gradually reverse from progesterone to estradiol. And it can happen without the squeeze, without the neural reflex trigger, but it's very slow. During that time, if the foal isn't kept at a constant temperature, kept in an environment where it doesn't get pressure sores, it's kept on parenteral nutrition, 20 to 30% of its body weight every 24 hours. If it's kept in that environment and kept alive, eventually, between 2 and 10 days of hospitalization, it will recover successfully. Not recommended, extremely expensive, especially when there's a very cost-effective alternative, which is the Madigan squeeze. Now, when assessing these foals as vets, we should be looking for other complications which are treatable, such as failure of passive transfer. Like I said, most of these foals are born normal. They have got their antibodies. Don't be fooled by a normal IgG test saying, oh, well, that foal's normal. It's not normal. It happened to get the colostrum, and then the neonatal maladjustment syndrome kicked in afterwards. But be aware of it, because obviously there is a high chance that there might be failure of passive transfer. There's nothing wrong with adjunctive therapy with plasma, antibiotics, and steroids. Steroid is a useful drug for anything that might be a little bit wobbly at birth. We know it matures the lungs and has other effects on the organs, and this is a syndrome with multi-organ failure. Just a word about how the disease was considered over 10 years ago. This was an interesting paper that shows that round about 2012, when this work was coming out of UC Davis, the Beaver produced this paper which alluded to the work by John Madigan. And it's an interesting paper historically, because it talked about the previous theories for neonatal maladjustment syndrome, which were hypoxia and ischemia, a little bit like the human condition of cerebral palsy. So some of these patients had a mechanism of cerebral necrosis and hypoxia and ischemia. Most of them didn't. And actually, we know that of the 80% of foals that survive and come through the dummy foal period, the neonatal maladjustment syndrome period, are always normal, unlike the case with patients who suffer from cerebral palsy, who display neurological signs forever. So anyway, this paper is interesting historically, but the other papers on the list, which I'll release, are the more recent ones, which are in line with the working theory about the neural reflex and the reversal of the sex hormones. we discussed. Now, coming to the actual Madigan squeeze itself, you need a piece of rope 10 to 20 foot long. It needs to be with a smooth braid, so I use climbing rope. It's got to be 10 to 15 millimeters in diameter. The thin rope, the sort of 6 to 9 mil, is just a little bit too cutting when you go on the foal. And you need to know how to tie a bowline. Once you've got the rope and the ability to tie a bowline, the rest is a doddle. So it's the internet and YouTube is plastered with videos of people tying foals up using the Madigan. All you got to do is type in Madigan squeeze and foal, and you'll see a plethora of various instructional videos. But it's rather like how you cast a cow, where you tie a loop around the cow's neck with a bowline, and then you wrap it up like a parcel. But the difference is the wraps are concentrated around the thorax in the foal rather than one back in the abdomen. And the first wrap of the foal goes between the front legs where a martingale would go. But the actual process of tying the foal otherwise is exactly the same. So you do one non-slip knot with a bowline, placing the bowline at the withers, and then pull the rope back, do a wrap around the thorax and a hitch and a wrap 6 inches back from that. And then the idea is you put tension on the rope, and it says 10 to 20 pounds, but what that means is, imagine walking a poorly trained Labrador that's trying to get away from you. That's the tension you put on, and you put that tension on, and then the foal will automatically fall asleep. It'll lie down, fall onto its side, and as long as you put the tension on, it will remain asleep for 20 minutes. And time it, because 20 minutes is the right amount of time. During that time, the foal may make 1 or 2 attempts to vocalize or get up, but actually, for most of that time, while you're applying pressure, the foal will remain absolutely silent. So this is the first wrap going between the front legs. He's got a rope with a specially adapted loop on the end instead of a bowline, but if you can tie a bowline, it's useful and it will serve you well for the rest of your life. And you can see then that the video is paused slightly, but here we are. So is making it nice and snug, is collected the rope up, dragging it through very quietly so it doesn't create friction burns. And the first wrap then is quite close to the withers. The second wrap is 6 inches behind, and then he just hooked it underneath himself. That's called a hitch. There's got 3 wraps around the thorax. The first one doesn't squeeze because it's secured by the bowline. The middle one and the back one does squeeze, and he's putting pressure on that like walking a poorly trained big lab, and then you hold that pressure on for 20 minutes. During that time, the foal will be asleep, and as soon as you release the knot, the foal then will jump up, and immediately it will look pretty much the same as it was before you put the rope on. It's not a miracle, but within 1 hour to 24 hours, most foals, 80% of foals, will start to return to normality. The foals that have the squeeze are 3.7 times more likely to survive and 15 times more likely to get up within an hour compared to foals that don't have the squeeze. There's no side effects, and this condition's got an 80% survival rate, whether you do the squeeze or not. But if you don't do the squeeze, there's a massive hospitalization cost, 2 to 10 days. So there we are. Thank you very much. And I'm going to unmute everyone now, just in case anyone's got any questions. Anyone?
Can you hear me?
Yeah.
Yeah. When you were saying about the first wrap of the rope
My name is Ellen Jackson.
How does it go through the front legs? Because if you tie the loop around the neck and then the bowline, the knot is on top of the withers or at the base of the neck.
Yeah.
Where do you then the long end? Where does that go then? Do you go down the side of the neck through between the front legs and then round and loop it on?
So yeah,
it's around one leg. Is it sort of?
I think the point of going between the front legs on the first wrap, and that's a good point, John, because that's the difference between doing a cow and doing a foal. If you go between the front legs on the first wrap, I don't think it's particularly necessary, but it gives you the reassurance you're not going to trap the windpipe on the foal.
And it stops it slipping back, I suppose. And it stops it
slipping back. Like you said, the bowline's secured at the withers, and there's absolutely no chance then that can squeeze the thoracic inlet. But when you see it done and do it, it kind of makes sense. It's one of those things you've got to do it to understand it.
Yeah.
My question is, do we have any of the rope in the hospital that we can have a go at later?
Okay, so a year ago, I sort of chopped up a climbing rope, and it's in room 101. There's various lengths of it. It's purple. I have got another climbing rope I can sacrifice as well, and then we can always buy some rope for those who want it. But we can have a practice, definitely.
There is a rope in the hospital, is the one that we use for like the foals that are coming in. So if you want to have a try, it's just very, very long. So that's the only issue. But we have one if you want to practice.
Yeah, the point is every vet on the road needs to have a rope in their car at all times. There's no point having one else. So from today, find the rope, get it in your car. You can't go to a yard and say, have you got any rope? We need to have a rope in the car. It's an essential piece of equipment. Well, I mean, the one in the hospital, but you need one in the car.
Is a long lead rope too thick or
no? One of those sort of very, very, very long ropes with the sort of tassels at the ends. That's the right sort of thickness. But yeah, I mean, it's not going to be beyond the wit of man for everyone to find a rope today. Any more? Nope. Marvelous. Right. So we'll meet tomorrow. Where I think, John, you're doing tomorrow, aren't you, or am I?
I don't mind. I thought I was doing Monday and Tuesday now.
Right, I'll do tomorrow, and it's going to be the initial check on the foal, or I can do the foal sepsis score. If no one's got any strong opinions either way, I'll just flip a coin and do one of those two. But by all means, let me know which of those two you prefer. And then John's got 2 Monday and Tuesday, and Sean's got 2 Wednesday and Thursday.
Yeah, well, provisionally I thought of doing one of them on approach to the collapsed foal, and then which would probably be, I suppose, on Monday, lead on from Graham's examination and maybe starting to talk about sepsis scores. And then I was going to do failure of passive transfer on Tuesday. So I'm not sure what Sean's topics are yet, but if anyone thinks of anything that they particularly want to talk about and for us all to discuss, I mean, these can go on longer than 6 days. Or we can have a little seminar at the end. So anything you're not confident with or want to talk about more and we haven't thought about, just let us know.
So yeah, okay. Well, I'll do the initial approach to the first examination on the foal then. Thank you, everyone.
Brilliant. Bye.
Yeah, I was going to get on to treatment later and enemas and stuff like that. So if we've got the assessment, then it naturally moves into treatment.
Okay.
Brilliant. Okay.
Thank you, everyone.
Thanks, Graham. Bye.
Bye.
Mm.